have Dr. Jossen Gastelum, who is a general dentist. He'll be sharing his experiences with us and some cases. So, Dr. Gastelum, whenever you're ready.
Thank you. So hi, everybody. I'm Dr. Jossen Gastelum. I'm a general dentist in Tucson, Arizona, and I'm going to be presenting a little bit for you guys about what I do as a general dentist. Alrighty, so on today's session, we're going to be talking about my pathway to becoming a dentist. We're going to talk a little bit about dental school, the things that I was involved in dental school, the things that made dental school fun for me, besides all the learning cool stuff on dental mannequins. We're going to talk a little bit about my day-to-day life as a general dentist, especially a little bit about my practice here in Tucson, Arizona, and I might even be able to show you guys a little bit around the office here. Then we'll talk a little bit about biomimetic dentistry, which is one of the aspects of dentistry that I'm really interested in right now, and it has a lot to do about bonding protocols and keeping things really conservative and minimal preparation. So I think that will be really interesting, and it's actually catching a big following on Instagram. So I don't know if anybody follows them. And then we'll talk through a case presentation and then a short Q&A if we have time. All right. So education-wise, I went to the University of Arizona. I'm from Tucson, Arizona, so I ended up staying in Tucson. And when I graduated from high school, I actually exceeded one of my state's exams that we had to take. And the state had this program that gave you a full ride scholarship to in-state schools if you exceeded your state exams. So I actually ended up getting a full ride scholarship to the University of Arizona, which was really awesome. And I decided to end up staying in Tucson. So I went there, I studied physiology. I graduated in May 2016, which seems like a long time ago, but so I did that, and I'm really happy with the experience, obviously, because financially it was a good decision for me. I grew up with a single mom, so I'm a first generation college graduate, first generation dentist, doctor. So for me, it was a really good decision to do that. So a little bit about my education at University of Arizona. Some of the activities that I think made a big difference on my application for dental school. So I'll talk a little bit about them here. So my first one was this organization called Flying Samaritans. And it's actually called Flying Samaritans because there's part of the organization that actually does go and fly down to this little town in Mexico. But ours was the University of Arizona chapter, and we actually would go down once a month to my mom's hometown in Mexico to do a free clinic for the community there, which was a really cool experience. But one of the things that I think made it even more of a highlight for me was that initially when I started in the club, they didn't have a dental clinic attached to the organization. So whenever I joined, I wasn't initially, pre-dental. I started off at the university as a pre-medical student, and I always thought, like growing up, that I wanted to be like a medical doctor. And actually, it was a funny experience because I was just so sure I was going to be a medical doctor. And right around like my sophomore year of college, I went to go get a physical just with like my normal physician, and we were talking a little bit, and I'm telling him like, hey, I want to be a doctor just like you. And he says, have you ever considered becoming a dentist? And I said, no way, I want to be a real doctor. So he was just telling me, no, seriously, like I'd really consider it. I have a lot of friends that are dentists, and it's not that I don't love being a doctor, but it's just a huge commitment time-wise. You have to be doing your residency programs, you have to be on call, you can't really enjoy your kids, have a family. So that was kind of a factor that kind of got me interested in starting to look at dentistry. And then I actually had a friend that her mom was a dental hygienist, and she got me shadowing with her mom's office. And the rest is kind of history there. So I ended up kind of going towards dental experiences there. But going back to the Flying Samaritans, so there was no dental clinic, and I thought that it was, a huge need, especially in the town that my mom was in. So I ended up starting the dental clinic at the University of Arizona chapter of Flying Samaritans by recruiting a dentist and then getting the dental clinic started there. So that was really, I think, one of my highlights on my application that kind of showed my dedication to dentistry. And then speaking a little bit more about college experiences, one of the other highlights of my experience was a summer program that I did that was called SMDEP, Summer Medical and Dental Education Program. I think now it's called SHPEP. But I did this program right between my sophomore and junior year of university. And I heard about it from one of my cousins who actually just had heard about it. And so I applied and I went to the Columbia University program there. And it was really, really cool. I got to work in the dental clinic there. I got to take some courses with like medical students, like biochemistry and stuff like that, just to get you going. But I think one of the biggest things was I met a lot of really cool people from across the country, and a lot of people that I'm still friends with this day. Like I still text them. We meet up like once a year. And I think that was just, it made me sure that I wanted to take this pathway. So as soon as I got back from the SMDEP program, it was a 6-week program, I started studying for my DAT. Thankfully, I was pre-medical, so I had already done most of the requirements for pre-dental, but I started doing that and then applied to dental school. So when I was applying to dental school, I kind of talked a little bit back about my background with a single mom. So applying to dental school is really, really expensive. And, taking all of these programs to learn how to study for the DAT, the actual application fees, the costs for like payments for, taking a spot in the class, all of that was really, something that I wasn't expecting. You hear a lot growing up about becoming a doctor or a dentist, and they kind of drill that into your mind going to college. But, they never really talk about all the, financial requirements that it takes to get into there. So thankfully, I got really lucky. My mom was super awesome. She worked, multiple jobs and helped me out as much as she could. And, I was able to help myself out a little bit there with some of my scholarship and grant money that I had in order to pay for that. So that helped a lot for, being able to do that. But it was definitely a big financial commitment to do that. So when I applied to dental school, I only applied to 6 dental schools. I got interviews at 3 of them, and then ended up going to University of Louisville, which I'll talk a little bit about. So I went to University of Louisville School of Dentistry. And the reason I ended up choosing them is I went and did my interview, and my initial top school whenever I was applying to dental school was Columbia University, and that was mostly just because I knew some of the people there at the program, and since I had done that summer medical and dental education program there, I thought it was the school that I wanted to be at, and just the whole Ivy League status, this whole thing meant a lot to me as like a first generation student. So that's where I initially thought I wanted to go. But whenever I was applying or getting my interviews, I was interviewed at Columbia University, and I was interviewed at Louisville, and I was actually waitlisted at Columbia University on December 1st, and I was accepted to University of Louisville on December 1st. And I stayed on the wait list. I did pay my deposit for University of Louisville, which was pretty hefty. I want to say like $1,000, $2,000 or something like that, which is a lot of money again for somebody who had just spent money taking the test and the test program and applying and all this kind of stuff. But I did end up doing that, and I'm really, really thankful for the opportunity to do that. I also interviewed at UNLV and wasn't super excited about that opportunity. So I ended up deciding to go to Louisville, and I'm really happy about it because I think I had a really good experience. So just a little photo collage here. I graduated in May 2020, which was the year that like COVID kind of took over. So it was kind of scary initially when it happened because thankfully I got to have the whole college experience from the beginning to almost to the end. But it was right before our spring break in our fourth year when they were kind of talking about like COVID kind of starting, and everybody was talking about rumors of the schools being shut down and like stuff like that happening. And then of course the world shut down. We kind of didn't know what to do. We were kind of on pause for a couple of months, and it was a really scary time for my classmates, for me personally. We were really unsure about what the future of dentistry was going to look like, especially because we didn't know about the way that this virus was being spread. People were talking about it being aerosolized, like they thought we were going to be the highest risk. People were afraid to come to the dentist. So basically, a lot of us were really scared about our future in dentistry. And as we've seen, these days, thankfully, it didn't end up being detrimental to the field long term. And I learned a lot from that experience. But actually, during that period when the world shut down, I had the opportunity to work at this face shield company that was making face shields for the state of Kentucky. So it was really weird for me to be just about to graduate as a doctor, dentist with the doctor title, and I was working a factory job essentially. But I think it all kind of it happened for a reason, and it just made everything that I'm experiencing these days a lot sweeter. So my experience in dental school, we had 120 people in our class. I think it was really cool for me because I got to be involved in a lot of things at the school. One of the things that I became part of was ASDA, which is the American Student Dental Association. And that was really cool because they're actually the ones that do a lot of like the social events at the school. But also I got to be the social media person for the school. And so I got to do a lot of that, which meant that I got to go to a lot of the dental conferences, which is where I met a lot of other dental students from across the country. So I got to go to like multiple conferences in California. I got to go to some in Chicago. I think one of my favorite ones that I got to go to was Lobby Day, which was where we got together with dentists from the American Dental Association, and we got to go to Washington, D.C., lobby our cases. We got to see how the senators and all the government kind of stuff worked. And I thought that was a really interesting experience outside of dentistry that I got to learn about policy. And I think that's really important for us as dentists to be aware of those issues and know who is speaking for us there. I was also the president of the Hispanic Student Dental Association at Louisville, which I thought was also a really good experience for me. Obviously, it's really funny because I was like one of the only Hispanic people at my school. I was definitely, one of the only Mexican heritage people at my school. So, I became the president of that. But I thought that was one of my favorite experiences also in dental school because I got to kind of share a little bit about my culture, but then also, teach some people a little bit of dental terminology. We got to do a couple of community events associated with it. And, it was just really cool. So I talked a little bit about this already, but I think getting involved in dental school is definitely the way to make your experience a lot more fruitful and, enjoyable. I think that also it's the easiest way to get to know people, to learn more about, dentistry in general. So again, I talked about the American Student Dental Association. Whenever you decide that when you're joining a dental school, definitely join ASDA. I think it is one of the most important things that you can do as a dental student because you have so many opportunities with it. And obviously later as a dentist, it makes a big difference there too. And then find whatever organizations. They had different types of organizations at that school. I was the president of the Hispanic Student Dental Association, but there was like an Asian American one. They had different types of like business clubs and so many different things that you can join it's almost, like another college experience. You can join like fraternities and just become part of different clubs. So I think that makes a big difference in your dental school experience. So my externship during dental school was between my third and fourth year, and thankfully I got to do that before COVID hit. And I did my externship with Indian Health Services, and they actually paid for like the lodging and a little bit of like, the food expenses and stuff like that for me to go over to Washington. And I did it at the Yakima Dental Clinic. And that was a very cool experience for me, not only because I had never been to Washington, but also because I got to learn a little bit more about public health dentistry. I work now in like a private practice, so it's really different than public health dentistry, but we provided a lot of dental services to the members of the reservation there. And a lot of it was emergency clinic, and they had like a walk-in clinic with like a certain number of slots that could come in. And in the morning, they had to be there by a certain hour and sign up, and there were only a couple slots. And then in the afternoon, another slot would open, and then a couple of slots for that. So the classmate that did it with me, both of us would run the emergency clinic, and we do a lot of extractions, a lot of pulpal debridement, which is the initial part of the root canal procedure. We do a lot of really big fillings, unfortunately, and there were a lot of like heavily decayed teeth that now, as a private practice dentist, I look at them and I would definitely be planning like a crown or something for long-term prognosis. But in public health, you give them the option, but a lot of times they don't want to take that option because it's expensive and people can't afford that. So the cool thing with Indian Health Services is that most of the dental work was covered by the reservations program that they had there. But one of the things that they didn't cover was the lab costs. So they would cover the cost of the crown, but they wouldn't cover the lab costs, which would be like a couple, like $100 or a couple $100. But for a lot of patients, that was a lot of money. So they actually wouldn't do that. And I would end up doing, really big fills that, I probably can still do these days, but I probably wouldn't do. And I think it really got me ready to take on like any type of case there. We also got to do some scheduled cases with like full root canal treatments and routine fillings on scheduled patients. And then we also had the opportunity to go to a summer camp with like a lot of children from the reservation. And we did, hundreds of dental sealants for those kids. So that was really cool. I really enjoyed that. Okay, so a little bit about general dentistry. So I'm a general dentist, which means that I do anything from fillings to crowns, extractions, root canals, etc. And general dentists can do basically anything as long as you are trained and are comfortable with it. So like kind of jack of all trades. So some people do implants, some people do more extensive root canals, some people do braces. There's kind of a little bit of everything that you can do, so you can find what you really enjoy doing. So specifically, the thing that I've been most interested in these days is like minimally invasive adhesive dentistry. So it's a lot of trying to save teeth with bonding protocols versus doing the traditional crown preparations that we were taught in school, which some of you guys may or may not know about these, and I'll talk a little bit about it later. But I'm really interested in that, and I recently finished a course in biomimetic dentistry with the Najad Institute, which I actually won on a giveaway, on an Instagram giveaway during the summer, or like that one time when the world was shut down. So I was on an Instagram live and I got chosen for that. So that was really cool, and it got me going with this program. I'm also interested in like facial aesthetics. I recently got Botox and filler certified. So that's another cool thing about general dentistry, is that you can relate a lot of things to like head and neck. And then as I talked about before, I think general dentistry is just an open opportunity to learn and do a little bit of everything. And you can really do what you want to do and refer what you're not comfortable with. And I think that the relationships that I have with my specialists, especially like root canals, molar root canals, I don't really particularly enjoy them. I know how to do them, but I don't really enjoy them. So I refer a lot of that out. And I think that having good communication with your specialist is, really important there. So I also wrote an article back when I was a dental student for the American Student Dental Association's magazine. And it talks a little bit about what to do when you finally get a job offer, and learning a little bit about, what's a fair job offer, what you should be looking for, what you should see as like red flags and all of that kind of stuff. So if you're interested in that, just let me know and I can send you the link to that. So a little bit about my practice. So I practice just north of Tucson, Arizona, in a little suburb that's called Marana, Arizona. And I am an associate at a pretty large private practice. We have 11 operatories. We have 4 doctors and 5 hygienists. So I'm one of the 4 doctors. And most of the time, it's not everybody working at once. It's usually 3 dentists working at once, but we do have one day when it's all of us at once, and it does get a little bit hectic there. We run from Monday to Friday, and Fridays are short days which end at 2 o'clock, and I don't get lunch on those days. I kind of just go from the beginning to the end of the day there. And factors that made me decide to join this practice and come back to Tucson is that I'm from Tucson, so I needed to be a little bit closer to family, and especially my grandma that's not in the greatest health condition now. It was really important for me to spend more time with her. So I initially did start working in Kentucky because at the time when the whole pandemic thing was happening, Arizona was being a little bit weird about getting your license and with our testing requirements, all of that kind of stuff. And they were being a little bit difficult to work with. So it was easier for me to get licensed in Kentucky. And I found a job opportunity in Kentucky that I'm really thankful for. And I'm really happy that I did that experience. But ultimately, with everything going on, it was important for me to come back home. Another factor that made me decide to come to this practice was the opportunity to learn, the potential for growth, and becoming a better dentist, potentially learning more procedures. I think the one thing that made me choose private practice over corporate dentistry, which you may kind of hear a little bit more about when you're in dental school and talking to your classmates. Corporate dentistry, a lot of times people feel like pressure to do certain treatments, pressure to meet a certain quota. And unfortunately, it shouldn't be that way, but it is sometimes. And for me, I wanted to feel like I could do the type of dentistry that I wanted to do. I could treatment plan how I wanted to treatment plan. I didn't want somebody pressuring me into doing treatment that I didn't want to do. And I think specifically private practice here allows me to really do like the stuff that I'm interested in, like the biomimetic restorations that I'm doing. And yeah, so that's why it was the right choice for me. It doesn't mean that corporate dentistry is bad, or that all private practice jobs are awesome, all corporate jobs suck, or anything like that. It really doesn't, because you could totally get really lucky and have a great corporate experience, and you could get unlucky and have a bad private practice experience. So it doesn't mean anything, but it's just one of my factors there. So one of the most important things I think to learn is you should search early. And for me, it didn't really end up mattering in the end because of the pandemic. A lot of people's job offers ended up falling through anyway. So even though they had been like interviewing for a job for months and they were like sure they were going to get a certain job, they didn't end up working at that office. And that was kind of a unique experience because of the pandemic that I don't think everybody goes through. But really, I think that like searching early is important, but don't stress about your first job being the perfect job, because there are so many of my classmates, and obviously me included, that aren't at their first job. So every opportunity is a learning opportunity, and that's how you have to view it. Obviously, you try and find the best opportunity and try and get as much experience as you can, but don't stress out about it. You'll figure out what you need to do there. So, All right. So a little bit about dental technology that I like using at my office. So we have a 3D CBCT machine, which is really helpful for us to help diagnose certain root canal-like lesions that usually you take a normal x-ray and it's hard to see it, because if you think about it, the normal x-rays that we take is just a two-dimensional image of something, and the world isn't two-dimensional, it's three-dimensional. So a lot of times those CBCT machines can catch things that you may have not caught on the 2D x-rays, and that's super important, I think, for us. We also have a couple of doctors in the office that do implants, and I'm hoping to get certified in implants soon also. But the 3D scanning machine is, I think, one of the most important things for treatment planning, that and the standard of care for planning treatment for implants. So I think that that's one of my favorite things that I have at the office. We also have intraoral cameras, which I can actually pull one out here. So we have intraoral cameras here, and these actually go into your mouth and take pictures, and technically are high definition, but my friends are always making fun of me because I like to post things on my story of a picture of the screen, and they're like, oh look, there's Jossen putting a picture of the screen, of a picture on the screen, and they're always laughing at me. But I think that the intraoral camera is it should be in most people's offices these days, but it's really important because insurance companies are really interesting to work with, to say the least, and they want proof of everything. So I take pictures of everything, and a lot of it is because I like to review my cases, after I'm done, and I learn a lot from every case that I do. I like to post, certain things on my Instagram with permission from patients, of course. And for me, it's really, a learning tool. But as you're continuing in your career, you'll find out that insurance companies like to deny claims for just about anything. So if you have picture evidence of it, the picture tells, everything. They can't deny things if you have a picture of it. So another really cool thing at my office that kind of got me going into the adhesive dentistry and biomimetic dentistry thing was the air abrasion units, which is this. Let me see if I can pull this out here. So this little tool right here. So this is really cool because it's basically like a mini sand blaster, and what it does is it cleans the surfaces of anything that you're about to bond. You can actually remove really small bits of decay with this. Whenever you're cleaning composites, you can actually use this to remove the last little bit of the composite, which is super awesome. It also helps to etch the surfaces before you bond. So if you're adding to an old composite, I think that is really helpful there. And of course, in biomimetic dentistry, the adhesive dentistry stuff that I'm doing, it's key to getting a great bond there. We also have an intraoral scanner, which is just basically a intraoral 3D thing that helps us to make models we can make them for night guards, we can make them for retainers, we can make them to send to the lab to have crowns made out of them. So when I first started here at this practice, they didn't actually have this scanner, and I was the one that one of the ones that was kind of really pushing for a scanner, because a lot of my classmates that were out at other offices had scanners. So when I first started, we were taking a lot of impressions. We were taking alginate impressions, which you'll probably do in dental school. We were doing PVS impressions, which you'll probably do in dental school. And those just are really messy. Patients don't really love them. And they're really kind of technique sensitive. They, if you take an impression and this actually happened to me recently because the scanner was being taken by one of the other doctors. So I took an impression of a patient for a night guard, and then when we poured up the impression, we separated it, and there was a little part of the tooth that had broken off. And so the only option there was to call the patient back and have them come back and redo the impression. And it's just such a hassle for patients, especially in private practice, and I think in the area that I'm in specifically. The area that I'm in is a little bit retired people with a little bit more money. They expect a little bit higher standard of care. and they get really frustrated easily if things aren't done, exactly perfect the first time, which is, I understand, because it's a little bit more expensive to be at this office versus like a corporate or like a public health office. But it does make things a little bit more stressful. So the scanner, you see it as you're getting that 3D scan as you're doing it, and you're seeing it. If there's like any error, you can go back, erase a little bit, and then add a little bit more, and it's super convenient. I love that. So another thing that we also recently added was something that's called the Shofu dental camera. And previously, and we still have a Nikon camera, which is just like the normal photography cameras. And it's super nice, but it's really hard to figure out. You have to figure out all the settings on the camera, which, just is really difficult to figure out. And it's also inconvenient because you have to take your gloves off to use it, because you can't sterilize it. You have to make sure you're not cross-contaminating with the patient and stuff. And the cool thing about the Shofu camera is it can actually be wiped down with the sterilization wipes. You can wipe it down. It's totally safe, and it has preset settings on it, and it has preset like flash on it, which can take pictures. You can take pictures, and they look pretty professional without really even trying. So it's cool because the assistants can do it, and has just made it, documenting cases a little bit easier there. Okay, so here's just like a little bit of like an example of some of the pictures that I've taken with the Shofu dental camera. So these I didn't really even try. I just selected like a mirror picture, and it was like preset there, and took the pictures. So I think it turns out really cool. Okay, so a little bit about a typical day at the office, and I'm going to take a drink of water because my mouth got a little dry. Okay, so a typical day at the office. So usually I have between 6 to 8 patients on what's called my production schedule, which basically means my like money making schedule. So I have one big column where I'm seeing my crown patients, my filling patients, extraction patients, and that's where I'm making my money. Sometimes, especially when we're all like in the office together, I only have one operatory to work out of. So I really will only see those 6 to 8 patients, and that's it. But on other days, I have a second and sometimes even like a third operatory to work out of. And so I'll have 2 to 3 emergency exams that come in on like a staggered schedule. So I'll be seeing like my crown patient. I'll go in, like numb my crown patient, go over to another operatory, see an emergency patient, then find out like, hey, they have a broken tooth and they need it extracted. Okay, cool. Are you okay with like waiting for me for a little bit? And then they're like, fine. And then I go back, finish my procedure, and then come back and extract the tooth, kind of that kind of stuff. In the second column, also, we usually schedule like the crown deliveries or anything like shorter, like a delivery of a night guard or delivery of a retainer or anything like that. So that helps. And then also in the second column, a lot of times are the new patients, and sometimes I have 2 new patients, sometimes I have 5 new patients. So I'm pretty busy doing that. So that's just on my patients, like patients that are my patients. And then also within that, as I'm doing my dental work, the hygienists also come over and ask me to come and do their hygiene checks, which is where we're checking for cavities and, just the basic routine checks that you get at the dentist. So I'll see some of those patients also. So sometimes I'll see only my 6 to 8 patients, and then a couple of hygiene patients. But some days I'll see like 18, 20 patients like in a day, just from all those patients that I'm seeing. And it's just because of the the size of our office, and we have a lot of hygienists. And just like today, I was running a little bit behind because I went over on one patient, and then the other patient I went and numbed, and then I went and finished, and all of that kind of stuff that's going on. It just it gets a little hectic sometimes, and it was initially pretty overwhelming as a new graduate, because you only have 2 patients. At least at my school, we only had 2 patients. We had one in the morning, and you like had 3 hours to spend on them. Then you had one in the afternoon, and you had 3 hours to spend on them. You can't do that in private practice, and especially where I'm at, it's like the patients get really mad if you take too long. Sometimes they'll come in and they'll be like, okay, how long is this going to take? Or like, how much longer? And I'm just like, I'm trying to do the right thing. Just like, let me do it right. So yeah, it can be stressful, but you get used to it over time. So I typically start at 8 in the morning. I see my patients from 8 to 12 p.m. and hygiene checks scattered throughout. And then I usually take a lunch period from 12 to 1. And sometimes if I need to see a patient during lunch, I'll see them during lunch. Sometimes if I go over a little bit during lunch, I'll do that. But I try and have the lunch period because it's, my time to just de-stress and relax and do my own thing. And it's really important to, stay, eat and not starve yourself during the day, because your day gets tiring really quick. And then I start again at 1 o'clock, and then I see my patients from 1 to 5 and have hygiene checks scattered throughout there again. Okay, so a little bit about biomimetic dentistry. So if you guys aren't aware already, and you might not be, because I don't remember being super into looking at dental stuff when I was a pre-dental person, especially because we talked about me being pre-medical first. But there are a couple of big Instagram names in dentistry, and one of them is Dr. Schiffenhaus. If you look him up, I should have actually put that on here, but he does these really cool crown preps, which are really flowy, and they just look wild when you're a dental student. You'll be like, whoa, how does that even stay on there? And it's all because of adhesive dentistry. So the advancements in adhesive dentistry have allowed us to more closely mimic the natural properties of teeth. And one of the big things about biomimetic dentistry is trying to maintain the nerve, the pulp vitality, and prevent the need for root canal treatment. So a lot of times when you're going in there and decay is really deep, you can accidentally hit the pulp just because you're so close to the pulp there. And they teach you some concepts of how to seal a certain amount of it's not technically active decay, but a certain amount of decay right over the pulp so that you don't hit the pulp. And you have to make sure you test the tooth before you do that. So make sure the tooth isn't dead already before you're trying to seal bacteria over it. But you kind of do this, and they have a lot of studies that show that these techniques are effective and they don't cause the need for root canals later on. So it's all about being as conservative as possible while still reinforcing the tooth. And as I talked about in the past and to this day, the general thing in dentistry is that we're using a lot of mechanical properties to try and hold preparations or restorations in place and crowns in place. And there are certain features like slots or pins or converging wall preps where they'll make the walls go like this so that the filling literally can't go up because it's being held by that wall. So a lot of those things they kind of put into your head in dental school, and they're that's what you have to do, that's what you have to do. And with adhesive dentistry, most of these retention features can actually be counterproductive, and they can put stresses in areas that lead to debonding, and they lead to those composite fillings acting like amalgam fillings. And actually they're even worse than amalgam fillings because once it debonds, it kind of just moves up and down in that little space, and cavities can continue growing in there. Okay, so a little bit about typical features of a retentive preparation. I was just looking at time here. So typical features of a retentive preparation. So as I talked about slots, pins, and posts, one of the things that they really drilled into our head was dovetails, converging walls for amalgams. And can you guys see my mouse there? Yeah, okay. So this little thing right here is called a dovetail. So it's basically a little area that's holding the amalgam in place there mechanically. These walls are pretty parallel, and they're really trying to hold the tooth in place. The converging walls that I'm talking about, instead of being like this, they're like this because they kind of hold the material in there a little bit more. Crown preparations, trying to get them as close to the gum line as possible without going, all the way under, but trying to get the preparation as long as possible so that, the crown will hold on. It's kind of like the concept of putting on a hat, and the hat holds on because your head's a certain shape and then the hat's a certain shape. It's the same thing kind of with a crown. So technically you should be making your crowns fit without really even needing cement, and the cement kind of just helps as additional friction there. So that's really important. These are some of my preps that I did in dental school that I showed that they were the ideal preps for the boards and like stuff like that. Keeping there's a certain thing that's called a ferrule effect that goes all around. You try and keep like a certain amount of natural tooth structure around the tooth in order to keep the restoration in. So all of those features, I think that they're still important, and a lot of times in certain cases I'm still not like fully into like relying on adhesion. Most of the time now I am. The more that I've been practicing and learning, the more I'm getting into it. But sometimes I still include a couple of these retentive features. But the preparation designs for adhesion are more conservative. They're a little bit more like saucerized, it's called. So more smooth transitions, no sudden sharp corners, which can cause stresses. One of the big things about biomimetic dentistry is maintaining as much of the biorim as possible, which is basically the amount like above the gum. And that's really important because that's one of the places where the natural tooth has the load bearing and like the structural integrity of the tooth. So whenever you do a normal crown preparation, if I go back to these, you can see how, all of that healthy enamel rim that's kind of like around there, you can see how you take that all down for the mechanical retention there. And so with the biomimetic preparations, you can see right here how much of the tooth is still like above the gum there, and right here on this side specifically, and like on this picture right there, you can see that also that you keep a lot of the tooth structure above the gum, and that just gives patients a chance to, if it still needs to be replaced in the future, there's a lot more tooth structure to work with. And then it also just helps with the natural properties of the tooth, kind of keeping the structural integrity of the tooth there. So some major concepts of biomimetic dentistry. So isolation is definitely key. Rubber dam is ideal, and what they always is like gold standard. That's a little bit harder for me as right now, as like the office that I'm at and the amount of patients that I'm seeing, because isolation and getting all of that done and the amount of time that it takes, I'm not really like super great at putting a rubber dam on. So a lot of times I use something that's called an isovac, which is basically like it's a bite block and a suction combination there, which keeps things like relatively dry, unless I'm like really sure, or if I want to like take pictures of stuff. Sometimes I'm getting doing the rubber dam a little bit more, especially if it's like if I'm doing like root canals or anything like that. You always have to do rubber dam, and that doesn't have to do anything with biomimetic dentistry. But with a lot of the stuff, I'm relying on the isovac. But rubber dam, which is that barrier that they put on there, is the ideal thing. So if you look at biomimetic dentistry, it's always rubber dam. Another concept is called immediate dentin sealing and resin coat, which is basically when you finish preparing your tooth, you put the bonding agent on it immediately, because that's when your dentin, which is the inner layer of the tooth, is the most fresh, and it's cut and it's clean, and you just like sandblasted it, and that's the time when it's going to be the most clean. So that's the best time to bond to it. Another concept is fiber reinforcement, which can help to bridge a lot of like fractures in teeth and gaps, and it also protects the bond, and it just creates a fail-safe, because whenever you're curing composites, they shrink over a little bit, and it's just the property of the composite. And if you can kind of minimize that shrinkage, it helps so much. Another concept is decoupling with time, giving that bond time to properly mature before you put like big increments of composite on there. One of the things when you work in a bigger office, they have materials that are called bulk fill, which is you just like put it in there and you put like a big glob in there, and then you cure it all at once. And that is really convenient, but a lot of times it doesn't make for the best bond. So being mindful of that and letting the bond mature really well and giving it time makes your restoration last a little bit longer. Another one is using Emax, which is just like a type of crown material, as your restorative material, and that's just because the modulus of elasticity is most like natural enamel. So yeah, that's just a type of material that we use in biomimetic dentistry. And then caries detector, which is a thing that tells you it dies. It's not always like correlated specifically to the decay, but most of the time when there's decay, the tooth is showing like less, like the collagen levels are different in there. So this actually tells you how bondable the structure is. So the darker pink it is, the more, the less bondable it is. And then when it's totally clean, it's the most bondable. So caries detector helps us to create those clean peripheral seal zones that I was talking about, where you try and maintain the vitality of the tooth. And then of course air abrasion, which I talked about. It's really cool and simple to just hit it with some sandblasting and make sure that the bond is the best that it can be. And then I just wanted to show like a quick little video, just like a little Instagram video of like all my bonding things that I do here. Let's see if I can pull this up. And if not, no big deal. Okay. So anyway, it's these are all the like major things that I use here. Let's see if I can play it again. It had like a little song, but I'm not gonna play it. Let's see. Okay, so this right here, this is called Clearfill SE Protect, and that's the bonding system that I use. And it's just, I really like it because it's what the Biomimetic dentists use, but also because it really, whenever you use this system, most people don't have post-op sensitivity, so it's really awesome in that sense. You don't have to etch or like use the etching system on the dentin, which also helps with like the sensitivity issue. Technically, it also has like fluoride included in there. It also, the primer also has a antibacterial property, so that helps a bunch with the bonding systems. The Clearfill Flowable, I really like that just because it's really highly filled and it looks good on the x-rays and it just works really well. And then the EverX Flow is that fiber reinforcement that I was talking about that you can put over cracks and stuff, and you can actually use to reinforce your fillings to make them stronger. Okay, so let's see. Is it still in full, or do you see everything? Good. Okay, cool. Okay, so case presentation. So I had a 22-year-old female patient. She was actually an assistant at my office, and she's now a dental hygiene student. She gave me consent to share this case. So tooth number 18, which is on the lower left over here, was root canal treated about 5 years ago at a public health dental office, really similar to the one that I was working at on my externship. And in most cases, whenever you do a root canal, especially, sorry, let me drink a little more. Okay, so in most cases, when you do a root canal, especially on those back teeth, a crown is indicated because the tooth becomes really brittle and is really prone to breaking. So in this case, she was underage at the time when they did the root canal, so they just did like a really big filling. But you can see there on the tooth how the filling is kind of separating from the tooth there. You see a little bit of like staining right there. And, it was showing signs of breakdown, and she's only 22 years old, so she's probably going to have that tooth for a lot longer. So, the filling did the job. She was under 18 when it was done, but now it's a really good time to do the full coverage and just make sure the tooth lasts as long as possible for the patient. So with these, minimal preparations, I try to choose my cases well because, I'm still kind of learning a little bit about it and trying to adhere stuff just with bonding. It, makes it a little bit more difficult. So you have to get patients that will understand, if something debonds, and I'll probably help them out and do it for free again if that needs to happen. But thankfully, I haven't had anything. I'm like knocking on wood, like anything debonding yet. But yeah, she was really willing to do that, and we obviously didn't charge her for the procedure. So I used her as a little like learning experience when I was first starting this. So right here you can see this is the initial excavation, and this was after I took all of the composite out, and you can see how much of the tooth structure is missing there. So it's hollowed out. So if I would have done a normal like crown preparation, basically all of this tooth structure would have been gone to make a little margin for the crown. And so this is why mostly that I decided to do this type of restoration, because I knew it was like so hollowed out like this that really a minimal preparation could help to keep this tooth a little bit longer. And if she needs to do something else later in the future, then we'll do it then. But she hasn't really had any problems with it. So this is where I did the initial dentin seal, which there's not really much dentin there to seal because it was all excavated during the root canal. But I sealed, I bonded all of the walls around there, and then this was before I had the EverX Flow, but we used this thing that was called Rib-On, which was another form of fiber reinforcement. So I put that Rib-On fiber reinforcement right in there to just like strengthen that canal space there, and just make sure that it was really solid there. And then here is where I filled it up a little bit with some composite. I'm filling it in incrementally like I talked about. And then this is kind of the final preparation after filling it and getting it all done. And so we're going to be bonding to this thing right here. So this was the final preparation that you can see here. And you can see, especially on this one, how much tooth structure I saved by doing it this way. Instead of a normal crown preparation would go all the way down to the gum. And I saved a lot of tooth structure here by doing it this way. So you can see, I really appreciate the Biorim thing that I was talking about earlier, especially on this case. And she actually still has her wisdom teeth there, so that was kind of a tough preparation too, but we made it work. So it's not perfect shade match. The tooth is still dark because it was root canal treated, but you can see there how the crown kind of just like lays a little bit above the tooth right there, and you can see it right here from the top here too, but she didn't really care because it's all the way in the far back, and whenever she like talks and opens her mouth, really you can only see the top part here. So I was pretty happy with the result there. The patient was really happy with the result, and I think that's one of the things that I enjoy doing the most right now, like daily, and I get a lot of patients that are happy with those results there too. Okay, so a few takeaways from the presentation today. So I think it takes some time to figure out what you like to do and what you don't like to do, and obviously that is reflected in me being a pre-medical student initially, and then going into dentistry, and then of course starting to be a dentist, and finding out that I don't really love doing root canals, so I refer a lot of those out. And I, as a general dentist, I can do them, but I don't have to do them. So I found that they just stressed me out a little bit more, and so I don't want to be stressed out, and I want my patient to have the best standard of care, so I send them to a specialist. So it just takes some time to figure out what you like to do and what you don't like to do, and you kind of have to try a little bit of everything out, and then see what's most interesting to you. And another big point that I want to emphasize is that dental school teaches you the basics, because they only have 4 years to teach you, and they teach you how it's always been done and what works. So all of these other preparation styles that I was showing with the normal crown preps and stuff, though that stuff works. It's been proven, it works, it lasts in your mouth. But it's up to you to keep yourself updated, especially when you become a dentist, and learn what works out in the real world, and figure out what you want to do then. So yeah, that's about it. And then I'll take a couple questions, and I just wanted to add some social. So I have my Instagram page that I just recently decided to make it public and start kind of doing creator kind of thing. So I make more posts on there, and so that's a public page now too. I post videos and reels and stuff on there. And then I just started a TikTok page about a month and a half ago. So I'm working on there, and but the people at my office are always making fun of me and laughing because I'm always trying to go viral. But so if you want to follow me on those pages, feel free, and you can also just DM me, and I'll answer any questions that anybody has.
Okay, so yeah, I think we have time for 2 or 3 questions. So I'm gonna be checking the chat box if anyone has questions. So I had a question. So you were talking about keeping updated with the field because it's changing. How do you actually stay updated with all the technology and everything?
So one of the weirdest things nowadays, obviously with everything with social media going on, is that Instagram, is one of the places where I find out a lot about dental stuff. That's the newest and greatest stuff. A lot of it is because my friends are posting, but sometimes it's people that I see on my Explore page. Sometimes it's people that I follow that are posting new techniques. A lot of that stuff I see on social media, and I'm also part of a few Facebook dental groups. where, you know, dentists from across the country kind of just like post cases and stuff on there. And you just stay updated that way. You can also just, you know, join like the societies, like the local dental societies, and get, you know, updated there. But really, like, social media, I think, makes one of the biggest difference these days.
Okay, another question is about like preparation for dental school. Do you have any tips, or how did you study for the DAT?
So I kind of talked to you guys before we started the presentation, but one tip for me, especially when you're about to take your DAT, is really like dedicate your time to studying for the DAT. So you're gonna be studying for it, and that's gonna be like your full-time job, and you're gonna, you know, study for it and sit there for 4 hours, and then go to lunch, and then come back and then sit there for another 4 hours, and then go to the gym and go home and study a little bit more. And the reason why I say that, especially because, you know, it is expensive. You don't want to be taking it multiple times, but also, you know, you just get tired of studying this so long. So if you just sit down and really, you know, dedicate your time to it, I think that your time will be wisely spent, and you won't regret having spent that time. But if you don't spend the time, and like, let's say you don't get a great score, you will regret not having spent that time. So most of the time, most people aren't, like, a lot of people, especially like friends and stuff, will be like, oh, well, I only studied for like a week and, you know, I did well. Like, a lot of people say that, and it's not true. They just like to say it just because they like to pretend like they're the smartest person in the world and stuff. And so don't believe them, because they'll say that to you, and then they'll be studying 8 hours a day, and, you know, they're totally lying to you. So don't believe it. Study what you need to study. Yes, some people are a little bit smarter than other people, and, you know, keep that, you know, get that information and like keep it in their head a little bit easier. But anybody can do it, and it just takes dedication to do it.
Like everything in life.
Yeah, exactly.
I think this be the last question. We have a question in the chat, actually, and it's a good overview of everything.
Mm-hmm.
So it reads, "Thank you so much for your presentation." And the question is, what is the most rewarding part / biggest challenge of being a dentist?
Okay. So I think the most rewarding part about being a dentist is, and it sounds so cliche, but like being able to help people every day, especially, you know, with the stuff that I'm doing these days. A lot of times people will have heard that the tooth is not savable anymore. You know, they think that the only option is to like extract the tooth, and, you know, that kind of stuff. And being able to provide that service to your patient, I think, is just super rewarding and exciting, especially when they're, you know, thankful about it. Sometimes they're not so thankful, and, you know, it just is what it is. But it's really rewarding to be able to provide those services to patients. And, you know, on a personal level, for me, it's just, you know, personal satisfaction seeing my dental work get better over time. Like, you know, when I first started practicing, like, you know, I thought I was like awesome already from the start. And then I look back at some of my preparations, and I'm like, oh man, like that was all right, you know, just like whatever. And you're just like constantly seeing yourself improving, and it's really exciting to see yourself improving. And I think it makes it boring if you never like try learning something new. So I think that's one of the most rewarding parts. The challenging parts, obviously, is it's the same thing. It's kind of working with patients, because patients are difficult. There are crazy patients. There are really nice patients. There are a lot of patients that you'll tell them, you know, you'll warn them about something, and then, you know, that something happens, and then they act like you never told them, and they're like shocked. And you're like, but I told you this. So I think working with people is one of the most challenging parts about it, because everyone has different personalities, and you kind of just have to learn to accept that some people are going to be super thankful and happy for your work, and some people aren't, and you don't have to be everybody's dentist. I think that's the biggest thing that I learned. You're not going to be the right dentist for everybody. So that, I think, definitely was one of the most challenging things, but it makes it all worth it when you see like the stuff that you're doing, and get to look back on your progress and your like the pathway. Like thinking back to me, you know, being a a kid of a single mom, and then suddenly I'm a dentist and I'm being called doctor by like patients and stuff. I think that's like a really rewarding and like proud moment for me and for like my family and my mom, all that kind of stuff. So.
Well, thank you so much. I wanted to say thank you for the advice and all the good informative presentation. I'm sure everyone enjoyed.